We're being joined now by Uber's Senior Director globally of Safety Products. Sachin Kansal is with us as we talk about how Uber is going to ensure rider and driver safety as we go ahead in these COVID times. Sachin Kansal, it's good to have you on the show. Give us an outline of what you're thinking of today. Here in India, the centre has decided to lift restrictions on Ola and Uber and other ride-sharing apps. States, of course, will have the freedom to take their own call, but presumably we can expect to see Uber back on our roads quite soon. So when that happens, what is it that you'd like to tell riders and users?
Ankita, thanks for having me over. The way we think about the announcements that we are making today is we are creating a new experience for a new normal. As lockdowns are lifted and as people start relying on Uber again to go wherever they want to, their expectations are going to be much higher when it comes to safety and health. So the way we are approaching this is threefold. First of all, our policies. So we are announcing a policy that starting today, both riders and drivers will have to wear face masks to be on the platform. Second, we have invested a significant amount of capital in acquiring these safety supplies. So if for India specifically, we've already acquired more than 3 million masks, more than 1.2 million shower caps for Uber Moto customers, as well as disinfectants and sanitizers. And the third leg of the stool is all the changes that we are making in the app itself, in the experience itself, both on the rider and the driver side. They will be asked to go through a checklist and make sure that they conform to that checklist before they can actually, for a rider, before they can go online and they can start providing trips. And for a rider, before they can take a trip, they will be asked for those confirmations. For example, on the driver side, they'll be asked to take a selfie, and our technology will be able to detect that they're actually wearing a mask before they can go online. And also there are several checks and balances in the process. So if a rider notices that a driver is not wearing a mask, they'll be able to cancel, they'll be able to provide us feedback, and we will be able to act on that feedback. And if we see that there are constant violators of our guidelines and our policies, we could even take them off the platform.
All right, that's very reassuring to hear. But at this point, Sachin Kansal, I think a recent survey showed that people are hesitant about being in a vehicle that's been shared by other people. So in terms of actual physical sanitization, what is it that Uber is going to provide? Will you have sanitation kits for drivers? How do you intend to take that aspect of it forward?
Yeah, cleanliness and sanitation is a very important part of our policies as well. We are requiring the drivers to sanitize their vehicle after every single trip. We are giving them, the first thing, Ankita, in this is we need to educate them. When we talk about sanitization and cleanliness, what is it that matters the most? So we have been working with organizations such as the World Health Organization, as well as several other public health authorities to understand from them. And what we have learned is that it is important for them to clean the highly touched surfaces. For example, the door handles, the seatbelt buckles, and so on. So we have been educating drivers on how to sanitize their cars. In addition, we have also been handing out cleaning kits and the health and safety kits for them. In about 14 cities, we have 90 distribution centers, and we have been handing them out, including disinfectants as well as hand sanitizers, and teaching them on how they should be using them. So cleanliness is definitely a big part of us developing confidence in the minds of riders that once they are ready to step out of their homes, we are providing them a clean, safe ride.
Right. Tell us a little more about Uber deliveries as well, because that seems to now be filling a particular gap in terms of people getting across supplies to their loved ones in these very strange times that we find ourselves in.
Yeah, one of the things that we found, I should say, as a backdrop to everything we have announced, we have done a lot of research. We have talked to riders and drivers over the last 2 months, and as things have evolved, how do they feel? What are they missing? What can we provide? What do they expect from us? Yeah. One of the things that came out of that was because of physical distancing and social distancing, people are unable to meet their loved ones. They are unable to meet their relatives. However, some of those relatives and loved ones may still need help. They may need certain supplies, and they may need care packages. So with what we want to do is we've started a service called Uber Connect, which we recently launched in India, where customers can actually send those packages using Uber over to their loved ones. And we think that that fills a very essential gap right now, given the times we are living in.
Right. Sachin Kansal, if there's one message that you'd like to send out at this point to people who are only now beginning to think of using public transport again, is it going to be safe going ahead? What is your message to those who are still very worried, very anxious, unsure about what to do?
I think my message will be they are right to be cautious and they are right to be erring on the side of safety. We are definitely erring on the side of safety. And my message will be, please hold us to a high standard. We are working very, very hard to meet that high standard. And as things evolve, we want to constantly learn from them. And second thing I'll leave them with is this is shared responsibility. This is not a problem that only Uber can solve or riders can solve or drivers can solve. We all have to work together and come together to keep each other safe. So all of us, we should play our role in the ecosystem.
All right. Sachin Kansal, thanks very much indeed for speaking with us.
Thank you for having me.